Hello, everybody. Thank you for being here today. Today, we are going to explore a respiratory virus which is now gaining popularity, the human metapneumovirus, or HMPV. We will discuss what it is, its symptoms, treatment options, and who is most at risk for severe complications. Let's dive right in. Introduction to HMPV. HMPV is closely related to RSV, another respiratory virus known for its causing significant illness in young children and older adults. Though it wasn't identified until 2001, it has become recognized as an important cause of respiratory infections. Like other respiratory viruses, HMPV spreads easily in the community, especially during the winter months when people tend to spend more time indoors. While many people infected with HMPV experience symptoms similar to the common cold, the virus can lead to more severe health issues for certain groups. In young children, HMPV can lead to bronchiolitis, which is inflammation of the small airways in the lungs, making it difficult to breathe. In older adults and those with underlying health conditions, the virus can progress to pneumonia, which can be life-threatening if not treated properly. HMPV is often diagnosed through PCR testing, which is highly effective in detecting viral infections. However, many cases may not be tested specifically for HMPV, and the virus is often misdiagnosed as a cold or flu. In a clinical setting, a doctor will typically make a diagnosis based on the patient's symptoms and the timing of the year, as HMPV tends to peak during seasonal outbreaks. Since HMPV doesn't have a specific antiviral treatment, management of the infection typically involves providing comfort and relief for the patient. This includes rest, fluid intake, and over-the-counter medications. For more severe cases, especially when the patient is having difficulty breathing, medical intervention such as use of nebulizers or oxygen therapy may be required. It's important to note that most healthy individuals recover fully without needing hospitalization. While anyone can get HMPV, certain populations are at much higher risk for complications. Infants and young children, especially those under 2 years old, are particularly vulnerable to severe respiratory symptoms like bronchiolitis. The elderly, especially those over 65, may face complications due to pre-existing health issues. Those with compromised immune systems, such as cancer patients or individuals living with HIV, also known as AIDS, are also at greater risk for severe forms of the disease. Finally, individuals with chronic lung diseases like asthma or COPD can face life-threatening complications from an HMPV infection. HMPV is spread in much the same way as other respiratory viruses. Practicing good hygiene, such as washing your hands frequently and avoiding close contact with individuals who are sick, are key ways to prevent transmission. Additionally, covering your mouth when coughing or sneezing, as well as cleaning surfaces often touched by multiple people, can significantly reduce the spread of the virus. In high risk areas or during seasonal outbreaks, wearing a mask can also help limit the exposure. In summary, while HMPV is not as widely known as other respiratory viruses, it can lead to significant health issues, particularly for vulnerable populations. Symptoms can range from mild to severe, and supportive care is typically sufficient for recovery. At-risk groups such as infants, the elderly, and those with weakened immune systems should take extra precautions. Prevention through hygiene practices and avoiding sick individuals is the most effective way to control the spread of HMPV.